to go ahead and get started with our afternoon session today. Thank you everyone who is joining us and tuning in for our 2 p.m. session. Today we are going to be discussing beyond prevention. So I'm going to go ahead and hand it over to Marianne now to go ahead and introduce our presenters for this afternoon.
Hello, I'd like to introduce our presenters today. We have two. Sonia is the peer support supervisor at Prevention Links and oversees a number of recovery-based programs. She has been working in the recovery field since 2015. Being a person in long-term recovery herself, she knows firsthand the importance of recovery support and engagement programs. Sonia received her master's in social work from Rutgers and is a licensed social worker and certified peer recovery specialist. And we also have Sabrina. She is the director of recovery support at Prevention Links. She graduated with her master's in social work from Rutgers just this past May. She has been with Prevention Links in some capacity since 2015. Her experience includes working with students and families at the Raymond J. Lesniak Experience, Strength, and Hope Recovery High School, which is New Jersey's first public recovery high school. She has also assisted with a number of initiatives with law enforcement and other community organizations, always working to increase accessibility to peer-based community recovery support services. They're going to be talking about beyond prevention. And if you have questions, you can put them in the chat box and we'll take those at the end of the presentation.
Thank you so much, Marianne. We're so excited to be here today. And this presentation is going to provide you with information regarding substance use, the factors leading to and effects of substance use, spectrum of use, and ways in which people can recover from a substance use disorder. We'll be discussing what peer recovery support is and how it can benefit individuals. So we want to begin by discussing the scope of the problem that we aim to address with our work. So there were over 20 million Americans with a substance use disorder in 2018. Of these, about 3/4 are abusing alcohol, nearly 40% were abusing illicit substances, and about 15% of individuals abuse both alcohol and illicit substances. The fact that 3/4 of individuals misusing substances are misusing alcohol shows that the problem is not an issue of legality, since alcohol is legal. Rather, it is a public health issue. Over 40% of those with a substance use disorder have an additional diagnosed mental health disorder, such as depression or anxiety. And the recent pandemic has made challenges for substance users even more difficult, and overall substance use rates have increased. Overdose rates have increased in the United States for January through June of 2020. And anyone can be affected by a substance use disorder. So just because someone is of a certain age, race, or socioeconomic status does not mean that they are more or less likely to develop a substance use disorder or be affected by substance use.
Now, we want to talk about the spectrum of use and exactly what we mean when we say substance misuse, substance use disorders. They're words that, I'm sure a lot of you are familiar with and that Sabrina and I use every day, but the general, population often mislabels things and interchanges these words incorrectly. So, because substance use is a spectrum. It's not a black or white thing. And, at the beginning of the spectrum is non-use. So that's just people who don't use substances, then engaging in substance use. So this is really just kind of like, partaking in the use of any minor mood altering substance. So this includes alcohol, having a drink on the weekend, experimental use, experimenting with a new drug, being like, I don't really love that, and never using it again. occasional use, even regular use, even having, you know, a glass of wine every night with dinner, if it's non-problematic, it's pretty low on that spectrum. So really, when we say non-problematic, we mean that it doesn't cause negative consequences in one's life. Then next is substance misuse. So that is using a substance in a way other than its intended use. You know, so taking someone else's prescription pain medication, you know, it's prescribed to them, not to you. So taking it is using it other than its intended use. Overusing a substance, you know, so drinking until drunk or blacked out. And substance misuse is also characterized by that it causes problems in areas of one's life. And then moving on to substance use disorder. So this is the term we use for a diagnosable disorder in the DSM-5, which is the Diagnostic and Statistical Manual. And basically, in order for someone to be diagnosed with a substance use disorder, they need to have these negative consequences in several areas of their life and the inability or difficulty to stop or change the behavior without help. So really the spectrum just ranges from non-use all the way down to diagnosable substance use disorder, which is considered a mental illness. Some signs of problematic use. So, we're just talk about no individual factor alone can determine problematic use. So if someone has one of these things, you know, it's difficult to say whether their using is problematic or not, but a few of these factors in combination is indicative of problematic use. So one of these is role failure, so it's not fulfilling obligations. So if you're a student, not doing your homework, if you're a parent, you know, not being able to take care of your child, operating a vehicle under the influence, confrontation or concern from others about use. So just meaning that there's other people in your life who are concerned about your use and they may or may not also confront you about these concerns. Reducing or quitting social activities, using more or spending more time using than planned. You know, so going to the bar for a drink after work and having 5, you know. Physical or psychological problems that are caused by or made worse by use. So if someone's depression gets worse after they begin using marijuana every day. Previous attempts to quit, continuing to use despite these problems, and then tolerance. So tolerance is essentially needing more of the substance to get the desired effect. So 3 drinks used to make you tipsy, but now you need 6 to get that same effect. And then withdrawal is negative physiological consequences when you don't have the substance in your body. So, I mean, the famous one, you know, alcohol and opiates are the ones that tend to come to mind with withdrawal. But I mean, there is physiological withdrawal from pretty much almost every substance. You know, this includes some like flu-like symptoms, or it could even result in seizures or death with certain substances as well.
So then we're going to talk a little bit about some of the factors contributing to substance use disorder. So how does somebody end up having a substance use disorder? And there are a number of different factors that contribute to this. They include biological, psychological, social, environmental, situational factors. In terms of biological factors, so it's possible that certain people are biologically predisposed to developing a substance use disorder. There's still a lot of research that needs to be done in this area, but there's also a lot of research indicating that there is a biological component. Also psychological, so people who are experiencing mental health symptoms or disorders are more likely to look to substances to self-medicate some of their mental health symptoms. Social environmental factors include people who might grow up in an environment where drug use is common. Maybe they have parents or siblings who use substances. They may be tempted to engage in use themselves because this behavior was normalized. So the substance use was seen to be normal. People who live in an environment where drug use is common They may be exposed to it more frequently, therefore normalizing that behavior. And then situational, there are situations that can prompt an increased substance use, such as trauma or having a traumatic experience, being prescribed an opioid for an injury or pain, for example, being introduced to opioids or other prescription drugs through close friends, families, or significant others.
So there's consequences of substance misuse and substance use disorders, and these occur both for the individual, so that is, what we refer to as the person who is directly impacted by the use, and to family, friends, loved ones, their community, and to society as a whole, which we refer to as being indirectly impacted. So, there's direct psychological and physical consequences for the individual. These can be from both acute and chronic use. There's also social consequences, isolation, interpersonal problems, and then family, friends, and community. They're not the ones misusing the substance, but they're essentially being exposed to the consequences as well. So for family and friends, there's psychological consequences. There's the worrying, the anxiety, the depression, the blame, the self-blame, all these things that come along frequently with someone in their life they're close with using substances in a destructive way. There's also financial consequences. Paying to, if that person's in legal trouble, paying to cover that, or giving them money so they can get drugs because they're acting on behaviors that are manipulative. There's interpersonal consequences. And then really on a larger scale for communities and society as a whole, there's also financial consequences. There's crime rates and incarceration. So the way that our society has responded to substance misuse is fairly punitive, and that is improving in a lot of states. But we wanted to talk also about, arguably what is the most severe consequence, which is overdose or acute toxicity. So in 2017, more than 72,000 Americans died from drug overdoses. That rate had doubled in the 10 years prior. So from 2007 to 2017, that rate has doubled. The rate that we are having right now in 2020 is even higher. And then there is of those 72,000 deaths, 78%, so 56,000 of those deaths were caused by opioids. Narcan is a life-saving drug. It can reverse an opioid overdose if administered in time. And we do not have that much time to get into, specific aspects of this, but, just know that there are advancements, pharmacological advancements that are helping, but not everybody has access to Narcan. Not everyone has someone to administer it. And then, just to touch on also like chronic illness, liver disease, alcohol is the most commonly used substance, and liver disease is a common, unfortunate physiological consequence to that. And then as I talked about before, just having the physiological addiction, the financial need to obtain money in order to obtain drugs, and then that typically leading to crime, legal implications, and for many people, incarceration as well.
So substance use disorder is a mental health condition. Substance misuse and other mental health symptoms can easily be confused. So some individuals use substances in an attempt to cope with their co-occurring mental health symptoms. And some people have symptoms caused by substance misuse that can mimic mental health symptoms. So symptoms can mimic each other. For example, depression, anxiety, mood swings, insomnia, mania, and hallucinations can both be a result of substance use. another mental health disorder, or a combination of both. And this really speaks to the complexity of mental illness and substance use disorder. So now that we've discussed a little bit about substance misuse and the consequences, we want to move on into discussing how change happens. So this model might be familiar to some of you. This is the stages of change model developed by Prochaska and DiClemente in the late 1970s. It was originally developed examining the experiences of smokers, but it's important to note that this model can be applied to any behavioral change. So in the pre-contemplation phase, this is when someone is unaware that they have a problem. They're not thinking about changing it. Really, there's a lack of awareness about problematic use. In the contemplation stage, this is when a person is aware that there's something in their life that could benefit from positive change, but they're weighing out their willingness or ability to change. In the preparation stage, this is when someone begins taking steps towards the change, but does not yet take any direct action. So they might be researching some different modalities, really just preparing. And action is when the person begins to implement the change in their life. Maintenance is when the change behavior becomes part of someone's everyday life. It's done on a regular basis. It becomes routine. It's also important to note that relapse can happen, but does not always happen. It's an optional part of the stages of change. It's also important to note that people can re-enter the stages at any point. And this is important because peer support can be incorporated throughout the different stages of change. So we really work with individuals throughout this kind of cycle, right, at any point that they're at. As I said in the beginning, this model can be applied not just to substance use, but to other behavioral changes. So an example I frequently use is I might tell myself, I really should start going to the gym. That's important. I know my physical health is important. And when I start kind of becoming aware of that, I might be in the contemplation stage. So I might be thinking, I know I really should do this. The doctor says I should work out, but I don't know, I'm really busy. I'm not sure what time I'll be working out at, or if I can fit it into my schedule. I'm not really sure I'm super motivated. And this would be the contemplation stage. In the preparation stage, I might be researching different gyms that are located close to where I work, or starting to look at my schedule and saying, well, if I wake up a half hour earlier, and that's really the preparation stage. And action would be taking the action, actually going to the gym, and maintenance is when that just becomes part of my routine. I get up a half hour earlier every day, and it's just part of my everyday life.
So recovery is, not linear. And, Sabrina was just discussing the stages of change. And I just want to note that somebody can be in different stages and participate in any of these recovery modalities. So according to the peer recovery model, which is what we follow and utilize at Prevention Links, you're in recovery when you say you are. So it is self-defined. And there's many pathways. There's many modalities. I just want to kind of go over a few of them. Honestly, the one that most people would think of first would be abstinence. And this is what a lot of people think of as what recovery is. So abstinence is practiced but not required in 12-step programs. AA and NA are kind of the well-known ones. And then the same goes for alternative mutual aid groups. So there's Smart Recovery, All Recovery, Women for Sobriety. Those are just some of the alternative mutual aid groups, which are essentially mutual aid groups that do not use the 12 steps. So these are programs that really kind of promote abstinence, I'd say, the most and kind of, state that abstinence is the goal. Peer recovery support is a model that incorporates peers who have lived experience into recovery support. So peers are people, like I said, with lived experience. They also go to trainings. So all peers attend recovery coaching training, which is a 30-hour training, and a ethics training, 15-hour training. And there's also many other trainings that peers can attend and that we send our, peers to at Prevention Links. But really the idea is that those trainings, in addition to their lived experience with addiction and recovery, can help them to be effective, because they can say, well, I was there, I did this, let me help you do this. Abstinence can be a goal if the participant wants that. But really in the peer recovery model, it's participant driven. So if a participant's goal is to just get their degree or get a new job, but they do not express wanting to stop using, they just want to maybe use a little less so that they're able to achieve their goals, that's what the peer will help them do. There's also medication assisted treatment, also known as medication assisted recovery. So it's available through various medications. The medications listed are methadone, Subutex, Vivitrol. Those are all different medications that work in different ways in the brain, but they can all assist someone with an opioid use disorder. Vivitrol can also assist someone with an alcohol use disorder. Medication choices are between an individual and their doctor and their treatment professionals, but these medications assist with withdrawal symptoms, help to lessen cravings, and this can be used, again, in combination with peer support, with mutual aid meeting attendance, or any other modality. And then harm reduction is a framework that has really kind of been gaining more traction in recent years, and it's basically not preaching the need for abstinence and, saying, again, abstinence can be a goal, but really the primary goal is reducing the most dangerous behaviors. So some of those could be using opioids or using drugs intravenously. Harm reduction promotes general well-being, but it does not claim that abstinence is necessary for improvements to be made in one's life. So it kind of lines up with the peer recovery support model, but harm reduction is also often done on a larger scale, on more of a community level, whereas peer recovery support requires a peer working one-on-one with a participant.
And we'll talk a little bit more about what peer recovery support is. So as Sonia mentioned, peer recovery support involves individuals offering services to others based on both training, formalized training, and their own lived experience. So peers are encouraged to talk about the ways in which they personally navigated certain situations in their recovery, if it will benefit the recovery. So this is one way that peer recovery support is different from clinical treatment. Clinical treatment providers don't typically, and often they can't, disclose anything about their own lived experience, whereas peers are encouraged to do so. You'll hear us say this frequently throughout this presentation, I'm sure. So peer recovery support is not considered clinical work. So peers are not licensed clinicians providing treatment, but it can often work in conjunction with a treatment. So peers work in a variety of different settings. It could be in a community organization, a treatment setting, but again, regardless of where they're working, their role is different than that of a clinician. So again, peers are trained to use their own lived experience in order to guide others through challenging situations or through the early recovery process. And at Prevention Links, Peers also receive weekly task supervision as well as clinical supervision, even though the work is non-clinical. So there is a licensed clinician that checks in with the peers. They review caseloads, and it's really just to ensure that the work that is being done is, one, we're staying in our lane so that we're not providing any clinical services, but rather linkages to those services, and also for the peers' own professional development, for everybody's really well-being. So these are some of the programs that we have at Prevention Links in the Recovery Support Division that are all peer-based recovery support programs. And we're gonna break them down and tell you about each of them a little bit more, but they do consist of the STAR program, a family support program, a recovery center, a program called Union County Helping Hands 365, Restore, and the Recovery High School.
All right, so first we're going to tell you about our recovery center. So, brief overview and a beautiful picture, which I'll explain what it is in a minute. So our recovery center started when we received a grant through SAMHSA called the B Corps grant, Building Communities of Recovery. Marianne is very familiar with this grant and the grant requirements and does great work with us for this grant. The grant is ending in, a week from today on September 30th. And we had this grant for 3 years. We have served a total of 121 participants. We've served more than that, but 121 participants have received individual recovery coaching. And the Recovery Center offers that individual coaching. We offer mutual aid meetings weekly. Right now we're offering three weekly meetings, and we also offer social recreational activities every weekend. We did thankfully receive a new grant, a new Recovery Center grant through SAMHSA's State Opioid Response Initiative. It's the Community Peer Recovery Center. So that grant just began. There was a little bit of an overlap, but we're moving, into fully being under that grant. And we're really excited because we're able to expand programming. So the B Corps grant was actually only for young adults. So under the age of 35. This grant, we can expand programming to all ages, which we're very excited about. And we're also able to now add additional mutual aid meetings. So we're going to have 5 mutual aid meetings a week. We are meeting virtually for those right now, just due to, restrictions we have at our site around COVID, but those were in person, but we are continuing those virtually. We'll also be doing skill building workshops and presentations. And we'll be continuing to do our social recreational activities, which are perhaps the most fun part of the grant. So the picture you see here is one of our, we call them coffee and canvas nights. It's kind of like a, like a paint and sip, but you're sipping coffee, and we have professional artists come in and volunteer their time to lead these and facilitate them. And this is one of our most popular activities. Our participants really seem to enjoy it. We also do open mic nights. So this picture is two of our very talented staff performing. We chose staff photos because we try not to get participants' faces in photos, hence everyone was blocking their face with their art. But yeah, two of our musically inclined staff performing at our holiday open mic night, which we held last year. We usually hold 3 or 4 of these a year, and they're, again, really popular, really fun, and a great opportunity for people to come out and meet like-minded people in recovery who are also interested in the, the things they're interested in and still have an awesome time without substances. Bowling, arcade, these are, again, just some more examples of some of the social recreational activities we do at the Recovery Center. And these photos are from about 3 weeks ago. we had a socially distanced hike. So we've been getting really creative with virtual social recreational activities, which is like a virtual game night. We did a virtual escape room. We do virtual movie nights, but we are starting now to do in-person outdoor social recreational activities. So we had a hike this Saturday coming up. They're going kayaking. So we just want to make sure all of our staff and participants are safe, but we are also trying to take advantage of the weather before it gets freezing out. So hope you enjoyed seeing some of the photos of our events. All right, so I'm next going to talk about our STAR program, which is the support team for addiction recovery. So this program it's very different than the Recovery Center, just because it has, it serves different participants, it has a different goal. So it provides peer recovery support and non-clinical case management services to participants. So it is specifically for participants with a history of opioid use disorder. Every participant of our STAR program is linked with a peer and a case manager. So we actually have two teams of peer case manager combos. So a participant will be linked with one of those two teams, and they will be receiving, again, both peer support and case management. It's a DMOS funded initiative. Right now it is in all 21 counties in New Jersey. It kind of rolled out a couple counties at a time. So we are the Union County STAR program. Our levels of service as of this month, we have 32 active participants currently receiving services. And then since the grant was implemented in May of 2019, we have served a total of 65 participants through this program. And again, we adapted everything, all of our programs, to offer our recovery support virtually. We are now offering it in person as well on an individual basis. We have a whole area set up with all, the PPE and protections in place that participants can come in and meet one-on-one. Again, socially distanced and wearing a mask. And yeah, we do, we distributed care packages recently in June to all our participants, including toiletries and snacks and resources and information. We assist participants with transportation to work and medical appointments, so we can actually buy them bus passes, train passes. We can pay for Uber or another rideshare company. And we host a weekly all recovery meeting for our STAR participants as well.
So all of our recovery support programs are really aimed at reducing barriers for individuals in recovery or seeking recovery, as well as enhancing their life. And RESTORE does that. It stands for Reemployment Support and Training for the Opioid-Related Epidemic. And this program, it's a unique program. It was implemented in November of 2019, and it's actually a partnership between Prevention Links and Urban Workforce Advantage. So Urban Workforce Advantage is they specialize in job development and job training, and they provide classes, trainings, including CNA classes, so a certified nursing assistant, an IC3 certification program, which is like a computer literacy Microsoft certification, as well as ESL. So Urban Workforce provides the job training, and what Prevention Links provides is individual and group support to those participants. And this is specifically for women who have been impacted directly or indirectly by the opioid epidemic. So we're really excited about this program. We've served 61 women so far in the first 9 months. In addition to providing individual recovery support, linkages to services, we also hold 4 monthly workshops for students and participants. So we offer 2 in English and 2 in Spanish. And topics really range. We've discussed, we've talked about what opioids are, what substance use is, what recovery is. We also did a workshop specifically addressing mental health and COVID, as well as, you know, different topics depending on the needs of the participants.
The next program we're gonna tell you about is our Family Support Center. So as I was sharing before, you know, about those who are indirectly affected, have a family member or a loved one who is misusing substances, that is who we serve through this program. So as of August 2020, we have served 79 individuals. So those are, again, family members, loved ones of someone who is or was misusing substances. So this can also be of someone who is in recovery. We have a weekly group, which is now virtual, and we utilize 2 different evidence-based curriculums, and we cycle through each one. So we utilize the CRAFT family training curriculum, and then the Smart Recovery Family and Friends curriculum. We also offer individual recovery support, and recently we've kind of taken on a new initiative to really expand our impact and expand programming to reach Spanish-speaking families and loved ones. So Union County has a fairly large Spanish-speaking population, and we were realizing that, you know, language is a barrier. And we were realizing that if we have several Spanish-speaking staff who are fluent in Spanish, and we realized for those families and individuals, we didn't mention, but also in our STAR program and our Restore program, we have staff who speak Spanish in those programs as well. So we can serve individuals who either don't speak English and only speak Spanish, or who are more comfortable, you know, speaking Spanish. If English is their second language and Spanish is their first one, and they are already struggling with, you know, feelings of shame or kind of uncertainty surrounding seeking help, it's often easier for people to say, like, okay, I'm more comfortable if I'm speaking in my native language. So we're working to expand our impact. We've been working to translate all material into Spanish, and we are in the process of planning to implement a Spanish-speaking weekly meeting as well.
So Union County Helping Hand 365. I often refer to this program as a recovery engagement program. And essentially what it is it's a 24-hour, 7-day-a-week hotline that connects individuals in Union County with peer support and linkages to treatment. It makes peer support accessible, as I said, 24 hours a day, 7 days a week. In addition to that, if someone is arrested for an opioid-related possessory charge in Union County, a peer recovery specialist is dispatched to meet with them. And that was really a collaboration and initiative from the prosecutor in Union County. And in 2020, in August, we did a virtual drug trends and awareness presentation, which was in collaboration with the Union County Prosecutor's Office. And we were really excited that we had a participant also attend and share their success story. So that was a wonderful opportunity for the participant. And I know for me personally, kind of seeing her have that experience. We've also partnered with local treatment centers to provide biweekly presentations on peer support services. I also think it's really important, I think I skipped over this, but since July 2019, we've served over 202 participants. And this initiative really started out a few years ago as a pilot program. It had a different name, but essentially it was the same effort. It was not 24 hours a day, it was specific days designated where individuals can go to the county police department or different police departments, and a peer recovery specialist would be dispatched to meet with them. That program was really successful, and we had a lot of people who were able to access treatment and different recovery support services, even bringing their friends to the police station so that they could meet with a peer. in hopes of accessing recovery. So based off of the success of that pilot program, we were able to expand it and provide the service 24 hours a day, 7 days a week, 365 days a year. And then the Recovery High School. So the long name is the Raymond J. Lesniak Experience, Strength, and Hope Recovery High School. We often just refer to it as RHS, or the Recovery High School. And this program is also a partnership. It's a partnership between Union County VOTEC and Prevention Links, as well as Simon Youth Foundation. Because of the partnership with Union County Vocational School District, it is a public school. So the Recovery High School is considered an out-of-district placement, but being part of a public school district, that means that it's of no cost to students or their families. And that's really important so that it remains accessible. Union County VOTEC provides the academic support. So teachers, the curriculum, were able to meet the graduation requirements of any school district in New Jersey, because we use a hybrid learning system using New Jersey Virtual School and some in-person instruction. And Prevention Links provides the recovery supports, and they're really incorporated throughout the academic day. And some of those recovery support groups include educating students about things like facts regarding substance use disorder, the effects of drugs and alcohol on the brain and body. Also informing students and exposing them to different recovery supports. So 12-step meetings, SMART recovery meetings, and other related topics. So relapse prevention, family history. We also have a Friday speaker meeting in which somebody from the community shares their experience, strength, and hope with the students. Students also meet with a recovery mentor for one-to-one recovery coaching. So this year in June, we were really excited. We had 6 high school graduates, 4 of which are enrolled in Union County College for September of 2020. We also had 2 students who received scholarships through the Simon Youth Foundation, so that was very exciting.
And we want to thank you guys for being here for our presentation. We like to make these presentations typically really interactive, but we have some exercises we do, and unfortunately they're difficult to translate into a virtual platform. So they involve a big piece of paper and writing things down. But we really hope that, we hope you have questions about some of the things we shared. We hope we can take a little bit of time to have a discussion about some of what we shared. This is our contact info. And I know that Marianne has been fielding the chat box, but if you guys didn't put questions in, please feel free to do so now. And we would love to discuss anything that we presented on or anything we didn't present on some more with you.